lab, what you're going to do is you're going to start with your step A. You're going to give us your 7 parts of step A, and then we're going to ask you your 6 rights of medication administration, and you're going to give us those just verbally. And then we're going to hand you your testing MAR, and you're going to take that, and what we're asking for you to do is look at your allergies. So in this particular MAR, your allergies would be to milk of magnesia. So you'd look down your MAR, and there you see milk of magnesia as your second med ordered. So you could cross that off and say, I'm not going to give that. I'll call the doctor on that and get that DC'd. You're also going to look at your start and stop dates to make sure they're within today's date, which I'm not going to say because we're going to use this videotape many, many times. You want to make sure your MAR is for the month that it is. And your patient will be one of your 6 rights. You're going to give your medication to the right patient. So we're going to set up our meds, and I think we'll start with injections first. So I'm going to find, and then we're going to say, okay, find an IM injection, find it for this date and this time. We're going to give you the date and the time, and you're going to look through your MAR. There's nothing on the first page, and then you're going to go, oh, there's Haldol. 25 milligrams IM every AM times 30 days. So the start and stop dates are good. There's no allergy to milk of mag. Haldol is not the same thing. So what you're going to do is you're going to find your Haldol. It's a shot, so you preferably be finding a liquid here. There's Haldol. That's your first check. You put it up to the MAR. Haldol, that's your second check. You're looking at the expiration on your label, 10/12. That is October 2012. It's still good. You look to see when it's open. This particular drug is good for 3 months. It's good to go. So you've got your med. You've done 2 checks on that. You're going to get your proper syringe, which I want an IM syringe. So I've got this particular one that happens to be 21 gauge, 1.5 inch needle. Or I've actually got another one here I can set up that has the syringe with a safety sleeve. And I'll find the proper needle to place on that. So either one would be correct, as long as you got the right length needle and right gauge for an IM. So I want this. I want 2 alcohol pads. And I want my gloves. Okay? So now I have to do a dosage calculation. It says Haldol 25 milligrams, IM every AM times 30 days. It's supposed to be given at 9 a.m. It's 9 a.m. or close enough there to meet within our time frame. So what I'm going to do is alcohol the top here. I've calculated my dose. It says 25 milligrams on the label. It says there is 25 milligrams per ml. So I know I'm going to give 1 ml. So I've alcoholed the top. I've drawn air in my syringe to 1. I'm going to go ahead and put air in my vial to displace what I'm going to take out. And I'm going to draw up 1 ml of Haldol. Remember I told you in class that you probably have to drop a little extra, flick out the bubbles, get them to the top. Bubbles displace medication, and you won't have the right dose if you have bubbles. So we do want to get out our bubbles. So we've got out our bubbles, pushing back up to 1. The top ring of the plunger is sitting on the 1. Okay, I've got that, and that is my last check for yes, indeed, it is Haldol. I am going to scoop up the cap carefully so you don't poke yourself, and never place a bare needle down on anything. All right, so I go to my patient and I do all my checks. Remember, you've ID'd them twice per your step A. I will put on my gloves. I will find the right site, which for this one I've got 1 milliliter, so I can put it in any of the 4 sites. I can put it in the deltoid, the vastus lateralis, any of the gluteal sites. I'm going to go ahead and choose the deltoid because my patient is right here ready for me. So I'm going to feel for the acromion process, go 2 finger widths down, feel for the muscle, and go right there. All right, I'll alcohol the site. I do have gloves on. I'll wait for the alcohol to dry. I'm going to hold the patient's arm firmly, go in straight at a 90-degree angle, straight on in. I'm going to aspirate ever so slightly to check for blood. No blood. I'm going to give at a moderate pace. And this is a retractable needle, so I'm going to retract inside them, and then I'm going to put this in my sharps container. Now I am going to document for the day. So it is the 27th today, so I'm going to put my initials that I gave it, and I'm going to put the site that I gave it. So I have to look at my site code here. I gave it in the left deltoid. The site code for that is 3. So I will put 3 in the box that it says site. I will go ahead and sign my signature at the bottom with my initials and my title. And I am done with my Haldol IM injection. Okay, we're going to tell you, move on to your sub-Q injection. So you're going to look. There's a sub-Q injection. It's for Lantus insulin, 20 units, sub-Q every day times 20 days. The start and stop dates are good. The allergies are okay. They're not allergic to Lantus. So I need to give this. I'm going to find my Lantus insulin. There's one check. I'm pulling it out of either the med card or the refrigerator. I'm putting it up to the MAR. That's my second check. That's Lantus. And 20 units with insulin, we do not have to do a dosage calculation. We do have to pick the correct syringe, which is an insulin syringe, and it has the units on it. So we don't have to do a dosage calculation. It's very nice. So I get my tools ready. I get my syringe, my medication. I've done 2 checks on that so far. My 2 alcohol pads and my gloves. All right, so 20 units. Gonna get alcohol, the rubber stopper. I have checked my expiration dates. Both the manufacturer's expiration dates and the date it was opened. It's good for a maximum of 28 days once opened. It's still good. I'm going to pull up my air to 20. Going to put 20 units of air in the vial because it makes it easier to pull my 20 units of medication out. This one we have to be ever so careful about getting every single bubble out. This insulin is very potent. Now, if I would have had another sub-Q that was not insulin, I would have picked a non-insulin sub-Q needle, okay, and syringe. So I'm going to go back and forth and get all the air up to the top and push it out. Then I'm going to get 2 licenses to check this, remember. So if you say you're 1 license, then I get a second license to check it, and what they're checking is that I have 20 units of Lantus insulin. Okay, you can either hand it to them this way, or if you're afraid you're going to bend the needle, which is very easy, you can hand it to them this way. Okay, so yes, they indeed say, yes, that's 20 units of Lantus insulin, and they at any time now can come and initial on your co-sign slot under Lantus and sign their name at the bottom. You can't sign, though, until you've given it. So you go to the patient, you put your gloves on, you pick a site. It has to be a fatty sub-Q site. So back here in the fat, what do we call them, the bingo flaps? Or the abdomen. There are some other sites, the top of the thigh, the buttocks. So alcohol the site. I have my gloves on. And we have checked before we give it 1/3 time that it is Lantus insulin. So I let that dry. I'm going to bunch up the fat. So I make sure I stay in the fat, and I'm going to go in at a 45-degree angle. So bunch up your fat. I'm going to do it in the tummy. Slide it right on in quickly. Give your medication. You do not aspirate on a sub-Q. This is a retractable needle, so I just retract it in the patient, and I put it in my sharps. I can come back to the MAR, and I initial under the 9 AM that I gave the Lantus, and I have to put the site here so I can go to my legend and put whatever site code it is. Right abdomen might be an F or a 3 or whatever that is, so you put that site code in there, and you make sure your signature is on the bottom. It just needs to be on the bottom once for the whole month. Okay, so remember that is a 2 license deal because it's insulin. Insulin and anticoagulants that are injectable. So if you gave your heparin, which is at the top of the MAR, if you gave your heparin 5,000 units sub-Q, Instead of the Lantus for your skills lab, heparin is also a double check, a cosigner too, because it's a injectable anticoagulant. All right, so we've done IM, we've done sub-Q, let's do a PPD. That is an intradermal. So we've got an arm for that. We will look on our MAR for our PPD. There it is. Yearly PPD in October. The start and stop dates are good. They are not allergic to tuberculin testing fluid. We know that it is a standard dose of 0.1 milliliters. So we do it on either forearm. You get your supplies, which is an intradermal syringe. It's the same that we use for sub-Q syringes. It's not an insulin syringe. We get our 2 alcohol pads. We get our gloves, and we find our PPD solution. There it is. Purified protein derivative. We match it up, purified protein derivative. Want it in October? It's October. All right. So what we're going to do is alcohol the top again, the rubber topper. We're going to put our 0.1 milliliters of air into the syringe. And it's often preset for you, but you can't guarantee that. And then put it into the vial. Flip it over. Let's get our fluid. Bubbles aren't as much of a problem with this. So if there's just a tiny little bubble that you can't seem to get out, it's probably okay. So 0.1, we've got that. We've done our third check. Yes, it is PPD fluid, purified protein fluid. And we're going to scoop this on. We're going to get our gloves on, go to our patient, look at their arm. Remember, we're going to stay away from tattoos, blood vessels, that sort of thing. So we're going to alcohol our site. Going to let it dry. And then this one, we have to be concerned with the bevel pointing upward. So when we actually go in the patient's arm, the bevel will be pointing upward, the hole in the end of the needle. So when we push our fluid out, it'll go up and make that little wheel. It won't on this particular arm. Okay, so I'm going to apply some counter traction to the skin. I'm going to go in at a 15-degree angle. I'm going to go in just enough to cover the hole and maybe a little bit more, the bevel. I'm going to go ahead and give my fluid. Oh, it did produce a wheel. And put this in the sharps. At any time after you give an injection, the patient may be bleeding. Cover your needle first. Get your needle retracted or cover it with your safety sleeve, whatever you have, before you deal with the blood on the patient, okay? So we will go ahead and let the patient know that we're coming back in 3 days to examine that test. And then when we come back to do our documentation, we've got to put the time in that we just did it. We've got to go down to the date we just did it. So it is the 27th today, so I'll initial under the 27th. I'll put my site code, which on this one was the left forearm, so LFA for left forearm, or just write it out, left forearm would be your site. And then we box in 3 days from now. So 1, 2, 3 would be the, if it's the 27th today, 1, 2, 3 would be the 30th. So I'll box out the 30th with a read.
I thought it was 48 hours.
48 to 72 hours. Most facilities we use are 72 hours. So we'll let you know when we get there. But for testing purposes, just use your 3 days. Make sure your signature is at the bottom. All right? Make sure you put the site code, because we can go back and we'll be looking at both arms otherwise if we don't know what arm to look at. Okay, so that should be it for injections. Let's move on to POs, which takes a little more time, but I'm just going to do a couple just to show you. So again, we're going to be administering them per our 6 rights. We're going to look at start and stop dates. We're going to look at allergies, make sure we're matching up the patient 2 times, ask them their name, look at their ID band, look at a picture, look at their face, see if it matches, etc. All right, so our first one on this MAR is calcium, 600 milligrams with vitamin D, PO daily, times 45 days. The start and stop dates are good. They're not allergic to it. So what we're going to do is we're going to find our calcium right here. That's our first check. Then we're going to match it right up with the MAR, put it right down on top of the MAR. And it is calcium, 600, and vitamin D. And it's due to be given at 9 o'clock. It's 9 o'clock now. So we don't have to put on gloves for this, but we do not touch the pills. All right? So you can get your cup out. It doesn't matter which cup you want to use. I'll get my cup out. Calcium 600. I have 600 milligrams in each pill here, so I give one pill. Simple as that. Use the cap so you're not touching. And then the last thing you do before you put it away is use your third check. And yes, it's calcium. You can turn it upside down if you wish. And another good thing to keep you organized is to put a little dot right there on your MAR at 9 o'clock on the 27th that it is now in your pill cup. And you've done all your checks. Okay, we're going to skip over MOM because we already decided that they're allergic to it, and we've either called the doctor or had somebody else call the doctor to notify him, and he's de-seated. Okay, the next one we go down to is DSS, 250 milligrams, PO daily, times 45 days. It's again due at 9 a.m., which is now. The start and stop dates are good. They're not allergic to it. DSS, you all know, is docusate sodium. So we're going to pull out our docusate sodium, 250. That's our first check. Looking at it here is our second check. And, of course, we're checking expirations, manufactured expirations on the pills. There is no open date because they're pills and not liquids. So 250 in each pill, 250 on the order is one pill. Okay, if you get too many pills in the cap, just put them back like this, never touch them. There's one pill in your cup. You've done your last check. Yes, it's DSS or docusate sodium. You can put it upside down or you can put it right side up. It really doesn't matter. However you want to do it, put your little dot under the 27th. Okay, we're going to go down here to Benadryl, 25 milligrams, PO, PRN, Q4 hours, complaints of itching times 5 days. Has the patient complained of itching? If they have complained of itching and they would like a PRN, what you would do is look to see when it was last given. You can give it, according to this, every 4 hours. So we look on the back, has it been given? If we say no, it hasn't been given, you can give it. Or if it's been given and it's greater than 4 hours, we can give it. Now, if it was just given 2 hours ago, you can't give it. You need to tell them, come back in 2 more hours. So if yes, we can give it, we will look for our Benadryl. There it is, Benadryl. The patient already says he wants it, so we can go ahead and put it in the same cup, okay? The start and stop dates are good. They're not allergic to it. It's Benadryl, 25 milligrams. And he does have itching. Now, remember, you can't give it if the patient has a headache or wants to go to sleep. You have to give it exactly for what it's ordered for. Okay, so 12.5 milligrams in each tablet. So we're going to give 2 tablets to make our 25 milligrams. And the expiration date is good on this. Oh my goodness. Don't. Okay, so we get our 2 pills out and we put them in here. Our candy is a little stale. Okay, put it upside down. Put our dot under the 27th. Don't write anything else out. Okay, so we're ready to give. This is all our meds for the morning. So we're going to have a drink for the patient, water, juice, whatever is appropriate for your facility or for the patient. And we're going to ID the patient. We're going to let them know what we're doing. It's good to have a little education going along with this. Your Benadryl may make you a little sleepy as well as help you with your itching. So don't plan on driving any, farm equipment or anything like that. So after we ID our patient and explain it, we're going to go ahead and give it to them. They're going to swallow. We're going to make sure that they swallow. So, you're kind of going to watch them. Make sure they don't choke on it or pocket it in their cheeks. So after they have taken it, we can go back and sign each of those meds. So our calcium we initial, our DSS we initial, and this is where those little dots are helpful. Our Benadryl will initial, and we have to go onto the back and explain it. So onto the back, we'll put the date and the time that we gave it. We'll put our medication, which is Benadryl, our strength, which was 25 milligrams, PO is our root. And then the reasons given, patient complained of itching. You can get a little bit more elaborate with that. Patient complained of itching on right forearm. And then you would come back in 45 minutes to an hour to put your results or effectiveness. And you ask him, are you still itching? He says, no, I'm not itching anymore. So you'd put no itching and the date and the time. Make sure your signature is on that page at the bottom somewhere, whether it's front or back, either or is fine. All right? And then we'll give you a grade, and hopefully you'll do very well. Thank you. Other than I did